Okay, this is my video submission for PNE. I'm doing a 360 of the room. I've already done hygiene and I have my gloves on. Okay. See? Okay, fix that later. Badge. And I'm gonna wipe my stethoscope. Diaphragm and bell side. Okay. Hello, I'm Rosalia. I'm a practical nursing student. I'll be doing a head-to-toe assessment to evaluate your overall health status. Can you tell me your date of birth and name?
My name is William Overton, April 2, 1933.
Perfect. Okay, if at any time you feel uncomfortable, please let me know. Before we begin, do you have to use the washroom?
No.
Okay. So I'll begin by looking at my patient's overall appearance. William appears to be his stated age of 92. His skin is even and tan throughout. There are no lesions or signs of injury on his face. Skin is symmetrical. There's no abnormal body odor present. He has a calm and neutral facial expression. He is able to maintain eye contact with me. And he is dressed appropriately for the weather. He, let's see. His work of breathing is regular. He's not showing any signs of respiratory distress. He is not showing shortness of breath. And he appears to be of average height and stature for his stated age. He appears to have optimal nutrition based on his physical appearance. His posture is upright and straight, and he has no difficulty maintaining his posture right now. So right now, I'll assess his level of consciousness. So please tell me your name, where we are, and what day is it?
My name is William Overton.
Okay.
We are in hospital.
What day is it?
Today is April 3, 2025.
Okay, perfect. So my patient is oriented to person, place, and time. So his level of consciousness is alert and oriented. Okay. So now I will assess his face. His face is symmetrical. There is no lesions. There is no edema. There is no bruising anywhere. I don't see any involuntary movements. His skin color is appropriate for his ethnicity background. And I don't see any yellowness or pallor or signs of any health conditions. I will test his cranial nerve number 7, the facial nerve. Okay, so please smile. Okay, can you frown? Can you be sad? Sad? Okay. Puff out your cheeks. Okay. And close your eyes as tight as you can while I apply resistance. Perfect. Okay, so cranial nerve number 7 for the patient is intact, as there was no signs of muscle weakness and movements were symmetrical. Moving on to the eyes, his eyebrows are sparse and evenly distributed. Eyelashes on bottom and top lids are even throughout. There is no ptosis or lid dropping on both eyes. There is no discharge or any crusting on the skin around the eyes. Upon looking at the eyes, the sclera is white, and when I pull down on the waterline, look up, conjunctiva is pink and moist. There is tiny blood vessels in the sclera, which is good. I will test for his cranial nerve number 3, the ocular motor nerve. So upon looking, pupils are both equal. They appear to be 3 milliliters in length. I'm going to shine a light to further test the ocular motor nerve number 3. Just look behind me, William, okay?
Mm-hmm.
Look behind me. Okay. Look behind me again. Okay, so based on Perla, pupils are round, reactive to light, equal, and now I will test for accommodation. So just look at the pen as I bring it to your nose. Just focus on here. Okay, so he is able to accommodate. The pupils were able to converge and constrict when the object got nearer to his nose, and then they were able to dilate when the object was brought further away from the nose. So pupil response is intact for direct and consensual response. Okay, so moving on to the ears. I don't see any discharge or excess cerumen present. Both ears look symmetrical and appropriately placed on the head, aligned with the outer canthus of the eyes. Now for the nose, it is midline. Nasal airways are both patent, and the nose is symmetrically placed on the face. For the mouth, it is pink and moist. There's no signs of dehydration or lesions present, so there's no signs of infection. Mr. William, open your mouth. I will test for cranial nerve number 9 and 10. Say ah.
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 Okay. So glossal, pharyngeal, and vagus nerve were both intact, as the patient's soft palate and uvula both rose when the patient said ah. Okay. Now for cranial nerve number 12, the hypoglossal nerve. William, please stick out your tongue and move it side to side. Okay, put it back in your mouth. Now say light, tight, dynamite.
Light, tight, dynamite.
Okay, so cranial nerve number 12, the hypoglossal nerve, is intact, as there were no tremors observed when the patient said light, tight, and dynamite. Now moving on to the neck. Neck is symmetrical. Skin is an even color throughout. There is no lesions or any abnormal pigmentation present. Now I will palpate and look for the trachea. Okay, so upon palpation, the trachea is not deviated. It is appropriately placed midline on the neck. And when I palpate, there is no enlarged thyroid gland, which is normal, and there's no superficial masses or swollen lymph nodes. Now I will test for cranial nerve number 11, the spinal accessory nerve. Okay, turn your head to the left.
To the left.
As far as you can.
The left, I see this one. Left.
Okay, left. And now to the right as far as you can. And to the left again, as far as you can. Okay. Now you're going to shrug your shoulders as I apply resistance. Mm-hmm. Again, down, and again. Again. Okay. So cranial nerve number 11 is intact, as the muscles of the sternocleidomastoid and the trapezius were both able to move against resistance. Okay. Now we're going to test for the carotid arteries. One at a time, we're going to test the rhythm and rate. So I'm going to count for 15 seconds and then times the rate by 4 on both sides. Okay, now the other side. Okay, so my patient had an equal rate on both sides of the carotid arteries. Grading is a 2+. The rhythm was regular and strong, and it was about 60 beats per minute, which is within normal range. Okay, now I will inspect the upper extremities. Patient will keep clothes on for their comfort. Okay, so upon inspection, both arms are symmetrical. Skin is an even color throughout. Body hair is evenly distributed throughout both arms. Now I will palpate both arms for temperature and moisture. Okay, so there was no superficial masses felt. There was no swelling, and no abnormal lymph nodes felt, and the skin was warm and intact. So I'm gonna have him hold his wrists out, and we're gonna test his radial artery. So you need your hands, okay? And we're gonna count for 15 seconds on both sides, and time that number by 4 and see what his radial pulse is. Okay, so pulse was 60 beats per minute, grading was 2+. It was both regular and equal on both sides, and it was within normal range. Now we will test his grip strength. Just squeeze my fingers with both your hands as tight as you can. Squeeze my fingers, okay? Both of them? Perfect. Okay, so his grip strength is equal on both sides. He was able to do the movement without any problem. Okay, now we will inspect his lower extremities. Upon inspection, there is skin is intact and even. Body hair is distributed throughout evenly. No lesions or swelling present. Now I will inspect for I will palpate for moisture and temperature. Okay, so there was no superficial masses felt or tenderness. Skin was warm and intact. And there was no any abnormal lymph nodes felt. So now we can move on to lungs. I just need you to face the wall. You can sit down. Can you turn a little, just a little? Face the wall, face the wall.
Like that?
The wall, this wall.
Oh, okay.
Yeah.
Like this?
A little more, a little more. A little more. Okay. A little more, a little more. Okay, perfect, perfect. So, okay. His posterior thorax, upon inspection, the skin is even and intact. There are no lesions present or any signs of edema. Now I will palpate and feel his breathing. Just take a deep breath, okay? Okay, so no superficial masses felt, no abnormal lymph nodes. Chest expansion was equal on both sides, which suggests normal diaphragm movement. Now I will auscultate in 10 spots on the back and listen to the sounds of his lungs. So when I tell you to take a deep breath, you take a breath, okay?
Okay.
Deep breath. I heard was the normal bronchovesicular sound in all spots on the back. There was no striding, no wheezing, no crackles, or any adventitious sounds, which suggests that the airways of both lungs are both clear and free from any blockage. Please face me. Now we're gonna auscultate for the heart. A little more. Okay. So we're gonna auscultate the apical heart rate. It's on the left side, mid-clavicular line, in the 5th intercostal space, which is the mitral valve of the heart. And we're gonna listen to the rhythm and rate of the heartbeat. And then count for 15 seconds and times by 4. First, I will landmark the heart rate. The left and the 5th intercostal space. Okay. Okay, so grading was a 2+. Beats were about 60 beats per minute. It was regular. All that was heard was the S1 and S2 sound, the lub-dub. There was no murmurs or any abnormal S3 or S4 heart sounds felt. Now we will move on to the abdomen. I will have you lay down on the bed. Okay. I'm gonna drape him so he's comfortable. Okay, that's it. So, upon inspection, the contour is even. Skin color is even throughout. There's no lesions, there's no edema present, or any bruising. Now I will auscultate starting in the right lower quadrant and listen to the bell sounds. Okay. Upon auscultation, bowel sounds were about 5 to 30 sounds per minute, which is normal. There was no absence of sounds. They were gurgling and they were high-pitched, which is all normal. I will press all 4 quadrants and see if any pain or tenderness is felt. Do you feel any pain? No? Any pain?
No.
So there's no superficial masses felt in any of the 4 quadrants. Do you feel any pain?
No.
No? Okay. That concludes our assessment, okay? Thank you, Mr. William.
You're welcome.